Welcome to this I3 Health interview. Today I have the pleasure of being joined by Gregory Salinas, who is the president of CE Outcomes, LLC. At the Alliance for Continuing Education in the Health Professions annual conference earlier this month, Dr. Salinas led a workshop titled Mastering AI-Driven Content Creation and Outcome Assessment. Today, he's here to share some additional insights from the session. Dr. Salinas, thank you so much for coming on to talk with us today. Would you like to start off by introducing yourself?
Oh, sure. So, I'm the president of CE Outcomes. We are a educational research company. We work with the supporters and providers of education to help them understand things like their target audience, where they like to learn, how they like to learn, what do they need to know, as well as the impact of education. So, how are clinicians putting education into practice? What are some of the things that from the education that really make sense and are meaningful to clinicians when they're managing patients, as well as what are some ongoing barriers, ongoing gaps, ongoing needs in the area as they think about future educational efforts.
Awesome. Glad to have you on today. So today we're discussing the workshop that you led at Alliance recently about mastering AI-driven content creation and outcome assessment. To start off, what are some of the ways in which AI is currently emerging as a tool for activity content creation, assessment, and outcomes in the CME, CPD world?
So right now, I think it is a work in progress. I think that there's a lot of things you can do with AI, and these are the things that we practiced at that workshop is developing questions, perhaps, that assess an educational activity. AI is fairly good at responding to the say data in a slide deck, text, and able to put together questions if you ask it in the right way. I've been that's kind of been one of the big takeaways I've seen is that if you're a little rushed for time, you can maybe at least get a start to some questions. It's not perfect. Some of the questions are relatively easy to answer. So again, it's just really, and I think this is overall AI is really a good place to start, perhaps, but to be able to layer on some expertise on top of that is always helpful. It's not great at figuring out little details sometimes or differentiating details, but to start with a blank sheet of paper and say, here's a good place to start. Using AI is a great way to do that. Things like developing images, perhaps for to display something, maybe a point you're trying to make, or have a patient interaction. Maybe you can display a typical patient you might see. And we even got into developing videos, AI videos around how you can perhaps have, whether it's little boxes that you're talking about, something from the researcher point of view, or even maybe thinking about having a patient case. I know that a lot of companies use actors sometimes when doing videos to portray a patient, but there may be a way to use AI instead of that to portray a patient as they're coming into a practice and having people respond and react to that.
It's really interesting. That's a really, creative idea to use it for videos in that way.
Yeah, and sometimes when you're presenting back outcomes, it's great to have that conversation or like someone describing it, but you can't always be on that call with every supporter, or they can't necessarily take that home with them. So having maybe a little box at the top that talks about the data, talks about the outcomes, talks about the impact of that on patients could be useful, whether you do it yourself through just taping or as I was talking in the workshop. I'm not great at going through a whole paragraph without making mistakes. So I like to maybe have my script, have it ready, and the ability to upload that into AI is pretty useful. There's some websites out there that we discussed that even allow you to create your own avatar. So it could even be your face, doing that. You're just not having to talk. You just upload your script and go.
Oh, wow. That's very cool.
Yeah, it's cool. It's a little scary, and we got into that too because it seems pretty close. You can see a couple little things here and there, but it's pretty close, and it can even use your voice. So it can get interesting. And again, I think that we're just now getting to this. I think we're maybe a year and a few months from the launch of ChatGPT, and AI has been a big thing for maybe the last 6 months. So we think about a year from now, 2 years from now, it's going to be a completely different landscape of where we are now. So we're just now really understanding the point of that.
Definitely. So as all these new platforms are emerging, are there any that you think are currently or will be the most useful or applicable for CME needs?
Yeah, I think, what we've seen is anytime that something is freely available, it's probably not that useful, unfortunately. So your basic Chat GPT, when you compare it to the paid version, it's so much less useful. The paid version will actually let you upload data. It will you can actually work through data where you can have it make a graph that you want of data. It can then even give you some basic statistics on that data if you set it up correctly. Um, the there are other ones that I think are in the works. You've got Google Gemini now. I haven't really had a lot of experience with that one. Microsoft Copilot, I think, is a great idea to have it built within the software. It's not there. It doesn't do hardly anything that you would want it to do. But I think that just building it in and then kind of working with that is a great idea. We're not there yet as far as the conception of it. You can even ask it to do things that you think it could do, or possibly, Chat GPT 4.0 can do, but it says it can't. So we're still kind of working out the details there.
Mhm. So you mentioned a little bit about this, but what are some of the limitations for using AI for CME CPD activity creation? And are there any steps that can be taken to kind of maximize the potential in light of these limitations?
Yeah, so for the first question, so we can start with limitations. I think it's only as good as what's inputted into it. You have to ask it very specific questions, and even sometimes the questions you ask you think are understandable, and it's giving you responses back that aren't quite accurate or not quite there yet. I think the idea with this is you have to think about it almost like, what kind of task would I give an intern, for instance, and they will do exactly what you tell them to, but nothing more. So you have to be very careful and look over some things like you would look over anything that's done by an intern, and just make sure that everything is accurate. So to that point, if you're having to check everything that's accurate, is it really that helpful? So couldn't you just do that in the first place and be done with it? And then probably, but I think there's some skills you can go. Prompt engineering is a big one right now. Is how do you write that prompt for an AI to get you exactly what you want? We went through a lot of this in the workshop where trying to just get it to do what you want through a series of questions, and how long it can take, especially if you have data that you've uploaded into the AI software platform. It can take, a minute per question sometimes. So, is it easier for me to probably make a graph in Excel versus asking ChatGPT to do it? Yeah, I could probably do it in 30 seconds, where it could take sometimes 15 minutes or so for it to get exactly what I want, because it has to review everything and recreate everything. But if you don't know how to do it, maybe, and you got a good set of commands, maybe that's useful for you. Other things that have to be considered are issues with privacy and copyright issues. I know, even with Gemini just being released, it says it's not going to be using your inputs and the data that you're putting in for maybe it's not using that for advertisement, but it also said yet. So you have to think about, well, then that's probably coming, is that they're going to be personalizing advertisements based on the types of things that you're going to be inputting. So you be very careful, read all the user agreements if you're concerned. And even there were people within the session that we had, their companies wouldn't even allow them to go to the websites on their work computer. So we had to go around that a little bit, partner up a bit. But there are some companies that are very conservative about this, and probably rightfully so, with all the potential privacy issues. Copyright issues are another thing, as we're creating images, etc. Just being aware of where that's coming from and how it's being used or how it's being created. I know that with any publication you do, if you use AI in the development of that publication, you have to disclose that.
Mm-hmm.
I assume like you would have to disclose any like individual's input into that paper, that manuscript. So then we got talking about, well, if you have to disclose that, what do you have to do, say, if you're putting together a grant request, or if you're putting together some content or slides based on using AI, should you have to disclose that too? So there's no guidance right now. I expect there will be sometime soon from your ACCMEs, your other kind of large accreditation or regulatory bodies. But right now there's not. So there's a lot of internal decisions that have to be made on how do you use some of these.
It's really interesting. It definitely sounds like it can be a very useful tool, but it has its caveats, its limitations. So it'll be interesting to see the different types of regulation that come into play as this all plays out.
Yeah, there's a lot of people, and I worry a little bit that the people that are talking about it are very, they're very optimistic, and you should be optimistic. I think you just have to remember at the end of the day, like, how this is being used and what the algorithms really do and what they are. It's a big, almost autofill, right? It's kind of a smart autofill. So how much would you take, what would you take away from your autofill text if you just kind of hit that middle autofill button all the time and created something? It sounds good, but is it real? Is it true? I think that it just always has to be thought about in that aspect, and it's not somebody on the other end that's actually putting a thoughtful response together.
That's a good analogy and definitely, important to keep in mind. So my last question is for CE companies that are interested in starting to use AI for their, activity creation and outcomes, how do you recommend they can get started?
So even the people at that audience, most of them had gotten started with some basic things like creating titles for their programs. Something small, something maybe creating outlines, or again, something to start with. Again, I wouldn't rely completely on AI. Some of the supporters in the audience did note that they were able to notice pretty obviously when people were using AI a bit too much in their grants, in their proposals. So I think that using it as a way to kind of start from a blank page, get some ideas going, is a great place to start, and really just trying some things. One of the big things that we did at that session was just letting people experiment, try some things, try putting in some ideas for images, try creating some icons and pictures and things using AI, and struggling a little bit with it to see what the capabilities are. You only get better once you really try to practice with that, like any other skill. So sitting down, having the time to practice, try out some things, use some tools like a chat GPT, using what's available to you and your team.
Definitely, it sounds great. So as a wrap up, were there any other points that were made in the workshop or any take-home messages that you'd like to share for the audience?
No, I think that's basically it. I say that the big thing is, if you're curious about trying or experimenting with AI in your education, just try and see how it works for you. Be very careful. As you're progressing with that, go slowly. Don't rely on it completely for 100% accuracy. If you're doing references, maybe use AI specifically for references and not your general ones, because you could get back things that are completely made up. So if you don't check it, it'll be wrong. So pick a tool, try it out a little bit, use it. But I guess don't be scared. But you don't have to go through with it. You don't have to go all the way. Well, I started here, but I think just make those tries, and see what you can do with it, and report back, because I think we're all still learning.
Exactly. Well, awesome. This is really fascinating to hear about all the different uses of AI and the things to keep in mind while using it. So thank you so much for coming on today to talk about this. It was really great to hear about.
It's my pleasure. Thank you.